You think inner peace requires hours of intense meditation or complex rituals. But Buddhist wisdom, accumulated for over 2,500 years, reveals that profound transformation can begin with something as simple as how you sleep. If you feel the weight of the day, the restless mind that won't turn off, know that this exhaustion is understood. When you just shift to your left side, you align your body with a natural flow of rest. You are not forcing peace. You are allowing it to arrive. Prepare to sleep while listening to this video. Subscribe to the channel. Leave your like and comment from which part of the world you are watching. Get comfortable and relax. Let's begin. Did you know that something as simple as your sleeping position could potentially benefit your heart health? It's fascinating how ancient wisdom and modern science sometimes align in unexpected ways. Sleeping on your left side has been recognized as beneficial for heart function for centuries, particularly in Eastern wellness traditions. And now, modern medical understanding is catching up with this insight. When you sleep on your left side, you're actually working with gravity and your body's anatomy to help your heart function more efficiently. The heart, which sits slightly to the left in your chest cavity, can pump blood more easily in this position because the major aorta that carries blood away from your heart curves to the left. This position allows for optimal blood flow through this artery, reducing the workload on your heart as you rest. In Buddhist philosophy, the heart holds special significance beyond its physical function. It's often regarded as the center of compassion, or what Buddhists call karuna in Pali and Sanskrit. Compassion is one of the 4 immeasurable qualities that practitioners aim to cultivate, alongside loving kindness, sympathetic joy, and equanimity. By taking care of the physical heart, some Buddhist practitioners believe they are supporting their capacity for emotional and spiritual compassion as well. Traditional Buddhist medical texts, particularly those from Tibet where medicine and spiritual practice are deeply intertwined, often discuss how physical health supports mental and spiritual development. These traditions view the body as a precious vehicle for awakening, deserving proper care and maintenance. The concept isn't about vanity or attachment to physical appearance, but rather about honoring the body as a temple for consciousness and a tool for spiritual growth. The relationship between physical heart health and the capacity for compassion isn't merely symbolic in Buddhist understanding. There's a physiological basis to this connection. When your heart functions efficiently, your entire body receives better blood flow, including your brain. This improved circulation can actually help balance your nervous system, potentially making you more receptive to feelings of empathy and connection with others. Buddhist practitioners often engage in heart-opening meditations, visualizations, and mantras designed to cultivate boundless compassion for all beings. These practices are believed to be more effective when the physical heart is healthy and functioning well. Just as athletes train their bodies to excel at their sport, spiritual practitioners aim to create optimal physical conditions to support their practice of compassion. In ancient Buddhist texts, the Buddha often spoke of the importance of balance and moderation in all things. This applies to care for the physical body as well. He advocated for a middle path between extreme asceticism and indulgence in physical comforts. Taking care of your heart through simple practices like mindful sleeping positions reflects this balanced approach to physical well-being as a foundation for spiritual development. The heart's rhythm has also been studied in relation to emotional states. Research suggests that heart rate variability, the variation in time between heartbeats, is associated with emotional regulation and resilience. People with greater heart rate variability tend to adapt better to stress and demonstrate greater compassion in their interactions with others. By sleeping in a position that supports optimal heart function, you may indirectly be supporting your emotional capacity for compassion. In some Buddhist traditions, particularly those influenced by tantric practices, practitioners visualize the heart chakra, anahata, as a center of energy that bridges the physical and spiritual aspects of existence. This energy center is associated with the qualities of love, compassion, and acceptance. Physical practices that support heart health are sometimes incorporated into these spiritual systems as a way to harmonize the body with higher aspirations. The physical position of the heart on the left side of the body has led many Buddhist traditions to associate the left side with receptivity and nurturing qualities. Sleeping on the left side is sometimes seen as a way of honoring and nurturing these qualities, allowing them to flourish during the important regenerative time of sleep. Just as a gardener provides the right conditions for plants to grow, mindful sleeping positions can create favorable conditions for compassion to develop. Modern research into the microbiome and gut-brain connection is revealing how deeply interconnected our physical systems truly are. The vagus nerve, which connects the heart, gut, and brain, plays a crucial role in regulating emotions and social connection. Proper heart function supports this vagal tone, potentially enhancing our capacity for empathy and compassion. This scientific understanding resonates with the Buddhist view that all aspects of our being are interconnected and interdependent. Even the sound of the heartbeat itself has significance in Buddhist practice. Some meditation techniques involve listening to the heart's rhythm as an anchor for awareness. The steady, rhythmic beating serves as a reminder of impermanence and the precious nature of each moment of life. By sleeping in a way that allows you to become more aware of your heartbeat, you may develop a deeper appreciation for the gift of life and the opportunity to practice compassion. For centuries, Buddhist monks and nuns have carefully observed the effects of different bodily positions on states of mind. These observations have been passed down through generations, creating a rich body of knowledge about how physical practices influence mental states. The recommendation to sleep on the left side is part of this wisdom tradition, reflecting an understanding that physical and spiritual well-being are not separate domains but aspects of a unified whole. By taking this simple step to support your heart health through your sleeping position, you're participating in a tradition of mindful physical care that spans centuries and cultures. You're recognizing that compassion isn't just an abstract spiritual quality, but one that can be nurtured through practical, everyday choices. This embodied approach to spiritual development is characteristic of Buddhism's practical wisdom and continues to benefit practitioners around the world today. Improved digestion and mindful eating in Buddhism. Have you ever noticed how your sleeping position affects how you feel the next morning, especially after a large meal? There's something particularly beneficial about sleeping on your left side when it comes to digestion, and this connection between body position and digestive health has been recognized in various traditional medical systems for thousands of years. The reason sleeping on your left side supports digestion comes down to basic anatomy. Your stomach sits to the left side of your abdominal cavity, and when you lie on your left side, you're using gravity to help food move more efficiently from the stomach into the small intestine. This position also helps prevent stomach acid from flowing back up into the esophagus, potentially reducing issues like acid reflux and heartburn. In Buddhist traditions, particularly those with roots in Asian medical systems, digestion is considered fundamental to overall health and well-being. The Buddha himself often spoke about the importance of moderation in eating and paying attention to how food affects both body and mind. There's a famous teaching where he advises monks to eat just enough to sustain the body, not too much, not too little, and to be fully present and mindful while eating. This mindful approach to eating forms an important part of Buddhist practice. In monasteries across various Buddhist traditions, meals are often taken in silence, with practitioners paying close attention to the sensory experience of eating, the flavors, textures, and smells of the food, as well as the physical sensations of hunger and fullness. This practice of mindful eating is believed to support not only physical health but also mental clarity and spiritual development. The connection between digestion and mental clarity is emphasized in many Buddhist teachings. When digestion is poor, it can lead to lethargy, brain fog, and irritability, states of mind that make meditation and spiritual practice more difficult. By supporting digestive health through practices like sleeping on the left side, Practitioners create favorable conditions for their spiritual work. This reflects the pragmatic approach of Buddhism, which recognizes that spiritual development doesn't happen in isolation from physical realities. Buddhist medicine, particularly as developed in Tibet, has extensive teachings about the relationship between digestion and overall health. These medical traditions describe how proper digestion creates nutritional essence that supports all bodily tissues, including the brain. Conversely, poor digestion is seen as the root of many diseases. By sleeping on the left side, practitioners support this crucial digestive function and thereby contribute to overall health. In some Buddhist traditions, particularly those influenced by tantric practices, the navel area is considered an important energy center associated with transformation and digestion. Just as the digestive system transforms food into nourishment, this energy center is believed to transform experiences into wisdom. Physical practices that support healthy digestion, including sleeping positions, are sometimes incorporated into these spiritual systems as ways to support this transformative capacity. The Buddha often used digestive metaphors in his teachings. He compared the process of learning and integrating spiritual teachings to the process of digestion, taking in what's beneficial, extracting its essence, and eliminating what's not needed. This metaphor reflects an understanding that spiritual growth, like digestion, is a process of transformation that requires proper conditions to function optimally. Traditional Buddhist monasteries often maintain strict schedules that include early dinner times, allowing several hours for digestion before sleep. This practice, combined with sleeping on the left side, creates optimal conditions for the body to digest food fully before the deeper stages of sleep begin. Modern research confirms the wisdom of this approach, showing that eating close to bedtime can disrupt sleep quality and digestive processes. The practice of eating 1 or 2 meals early in the day, common in many Buddhist monastic traditions, also supports digestive health. This approach gives the digestive system adequate time to process food completely before sleep, reducing the workload on the body during rest periods. When combined with sleeping on the left side, this creates a comprehensive approach to supporting digestive health. In Buddhist teachings, the body is often described as a guest house for consciousness, deserving care and respect but not excessive attachment. This balanced approach encourages practitioners to care for physical needs like digestion without becoming obsessed with physical comfort or appearance. Sleeping on the left side exemplifies this middle path, a simple, natural way to support bodily function without elaborate or expensive interventions. The Buddhist emphasis on interdependence, pratitya samutpada in Sanskrit, applies to understanding digestion as well. Digestive health doesn't exist in isolation but depends on numerous factors: food quality, eating habits, stress levels, physical activity, and even sleeping position. By recognizing these connections and making skillful choices in each area, practitioners honor the interconnected nature of health and well-being. For lay Buddhists who don't live in monasteries, principles of mindful eating and supportive practices like left-side sleeping offer practical ways to bring Buddhist wisdom into everyday life. These approaches don't require special equipment or elaborate rituals, just attention and intention applied to ordinary activities like eating and sleeping. Traditional Buddhist communities often pass down practical wisdom about health alongside more formal teachings. This practical knowledge includes observations about how different sleeping positions affect various bodily systems. The recommendation to sleep on the left side for digestive health is part of this tradition of embodied wisdom, reflecting centuries of careful observation and experience. Modern scientific research increasingly confirms the benefits of left-side sleeping for digestion. Studies have shown that this position can reduce symptoms of gastroesophageal reflux disease (GERD) and improve overall digestive efficiency. This convergence of ancient wisdom and modern science highlights the practical value of traditional knowledge about the body and its functions. By adopting practices like sleeping on the left side, we participate in a tradition that recognizes the profound connection between physical well-being and spiritual development. We acknowledge that the journey toward greater awareness and compassion is supported by practical choices that create harmony within our physical being. This embodied approach to spiritual practice remains one of Buddhism's most valuable contributions to human well-being. Beyond supporting heart function and digestion, sleeping on your left side offers another remarkable benefit that connects physical health with broader well-being. The lymphatic system, a crucial but often overlooked network in our body, functions much more efficiently when we sleep on our left side. This positioning creates ideal conditions for this important cleansing system to do its work while we rest. The lymphatic system serves as your body's natural cleaning crew, unlike the circulatory system, which has the heart as a pump. The lymphatic system relies largely on bodily movement and gravity to move lymph fluid through its vessels. This fluid carries waste products, toxins, and pathogens away from your tissues to be filtered through lymph nodes and eventually eliminated from the body. When you sleep on your left side, you're essentially using gravity to help this process along, as the majority of your lymphatic tissue and the largest lymphatic vessel, the thoracic duct, are located on the left side of your body. This enhanced lymphatic flow during sleep is particularly important because your body performs much of its detoxification and repair work during rest hours. Your immune system, which is closely connected to lymphatic function, becomes more active during deep sleep stages. By sleeping on your left side, you're creating optimal conditions for your body to cleanse itself of accumulated toxins and strengthen immunity, potentially reducing your susceptibility to illness. In traditional Buddhist medical systems, particularly those preserved in Tibet, there's a sophisticated understanding of the body's natural detoxification processes. These traditions view physical purification as inseparable from mental and spiritual purification. Just as the lymphatic system removes toxins from physical tissues, meditation practices are designed to remove mental and emotional toxins like anger, attachment, and ignorance from the mind. Ancient Buddhist texts often compare the mind to water when it's muddy with impurities. We can't see clearly, but when those impurities settle or are filtered out, natural clarity emerges. This parallels how the lymphatic system filters impurities from bodily fluids, allowing for optimal cellular function. By supporting lymphatic drainage through left-side sleeping, practitioners create physical conditions that mirror and support their spiritual practice of purification. The concept of purification appears throughout Buddhist traditions in various forms. Many practitioners begin their meditation sessions with visualization practices that involve imagining light or purifying substances moving through the body, cleansing it of impurities. These visualizations aren't merely symbolic, they reflect a sophisticated understanding of how mental imagery can influence physiological processes, including immune and lymphatic function. This connection between physical and mental purification is particularly emphasized in Vajrayana Buddhism, sometimes called Tantric Buddhism, where practitioners work with subtle energy channels in the body that are believed to influence both physical health and states of consciousness. These practices recognize that blockages in the body's natural flow systems, whether physical or energetic, can lead to imbalances in both physical health and mental states. Buddhist monastics throughout history have incorporated practical health wisdom into their daily routines. Many traditional monasteries are located in mountainous regions with clean air and pure water sources, reflecting an understanding that environmental factors influence the body's ability to maintain purity. Similarly, the simple practice of sleeping on the left side represents practical wisdom that supports the body's natural purification processes. Modern research increasingly confirms the importance of lymphatic function for overall health. Scientists have discovered that the brain has its own specialized waste clearing system, called the glymphatic system, which becomes much more active during sleep. This system helps clear out proteins and metabolic waste products that accumulate in the brain during waking hours. Some research suggests that sleeping on your left side may enhance this crucial brain cleansing process, potentially reducing risk factors associated with neurodegenerative conditions. The emphasis on purification in Buddhist practice isn't about achieving some kind of perfect purity or sterility. Rather, it's about creating conditions that allow natural health and clarity to emerge. Just as a gardener doesn't make flowers grow, but creates conditions favorable for growth, Buddhist practitioners aim to create conditions, both mental and physical, that allow natural well-being to flourish. The simple practice of sleeping on your left side is one small but potentially significant way to support these conditions. For people living busy, modern lives, finding time for formal purification practices can be challenging. This is where simple lifestyle adjustments like sleep position become particularly valuable. They require no extra time or special equipment, yet potentially offer significant benefits for physical and mental well-being. This accessibility reflects the pragmatic spirit of Buddhist practice, which has always emphasized working with the conditions at hand rather than requiring elaborate rituals or extreme measures. Some Buddhist communities observe regular days of cleansing, which might include fasting, specific purification meditations, and increased water intake to support physical detoxification. These practices are seen as complementary to daily habits like mindful eating and proper sleep positioning that support the body's natural purification processes throughout the year. Together, these practices create a holistic approach to purification that addresses both acute and long-term needs. The Buddha often emphasized the importance of balance in practice, neither excessive self-indulgence nor extreme asceticism, but a middle path that supports health without becoming fixated on the body. This balanced approach to physical care includes simple, natural practices like sleeping on the left side, which support bodily function without requiring obsessive attention or elaborate regimens. By maintaining healthy lymphatic function through practices like left side sleeping, we support not just physical health but also the mental clarity that facilitates meditation and mindfulness. When the body's systems function efficiently, we experience less discomfort and distraction, making it easier to maintain present moment awareness throughout our daily activities. This creates a virtuous cycle where physical well-being supports mental clarity, which in turn informs choices that promote physical health. Another benefit of sleeping on your left side relates directly to the quality of your sleep itself, which has profound implications for both physical health and mental well-being. Many people struggle with snoring and related breathing issues during sleep, which can significantly disrupt sleep quality for themselves and their partners. Sleeping on your left side can help reduce these problems, creating conditions for more peaceful and restorative rest. Snoring occurs when airflow through the mouth and nose is partially blocked during sleep, causing the surrounding tissues to vibrate. This can happen for various reasons, including relaxation of throat muscles, the position of your tongue, or anatomical features like a deviated septum. While sleeping on your back often makes snoring worse because gravity pulls the tongue and soft tissues backward, sleeping on your side helps keep these airways more open. The left side specifically offers additional benefits beyond just reducing snoring. This position helps align the spine, which can reduce pressure on the airways. It also works with gravity to prevent stomach contents from pressing against the diaphragm, which can otherwise push up and create pressure on the lungs and airways. For people with sleep apnea, a serious condition where breathing repeatedly stops and starts during sleep, side sleeping can be particularly beneficial. In Buddhist communities, especially in monasteries where practitioners live in close quarters, consideration for others' sleep is viewed as an important expression of compassion. Reducing snoring through mindful sleep positioning shows care not only for your own health, but also for the well-being of those around you. This reflects the Buddhist value of considering how our actions affect others, even during times when we're not consciously aware, like during sleep. Quality sleep has been valued in Buddhist traditions for centuries. The Buddha included mindfulness of sleep patterns as part of the foundations of mindfulness practice. He recommended moderate sleep, not too much, not too little, recognizing that adequate rest supports mental clarity and emotional balance. in many Buddhist texts. The moments just before falling asleep and just after waking are highlighted as particularly valuable times for mindfulness practice, as the mind is in a receptive transitional state. Buddhist monastics typically follow sleep schedules aligned with natural rhythms, often going to bed shortly after sunset and rising before dawn. This practice, combined with mindful sleep positioning, creates optimal conditions for restorative sleep. The early morning hours, what is sometimes called the Brahma Muhurta in related Indian traditions, are considered especially conducive to meditation. And waking refreshed from quality sleep helps practitioners take full advantage of this auspicious time. The connection between sleep quality and mental states is well recognized in Buddhist psychology. When sleep is disrupted by conditions like snoring or sleep apnea, it can lead to increased irritability, reduced concentration, and heightened emotional reactivity, all states that make spiritual practice more difficult. By addressing these sleep disturbances through simple adjustments like sleeping on the left side, practitioners support their capacity for mindfulness and compassion during waking hours. Modern sleep science confirms what Buddhist practitioners have long observed about the importance of sleep quality for mental well-being. Research shows that disrupted sleep affects emotional regulation, decision-making, and even moral judgment. During quality sleep, the brain processes emotional experiences from the day, consolidates learning, and clears waste products. When sleep is fragmented due to breathing problems, these crucial processes are impaired. In some Buddhist meditation traditions, practitioners work with awareness of the breath as a primary meditation object. This focus on breath extends naturally to an interest in breathing quality during all states, including sleep. By sleeping on the left side to maintain open airways, practitioners support continuity of clear breathing between their waking meditation and sleeping hours, creating a more integrated practice. For individuals practicing lucid dreaming as a spiritual technique, something found in certain Buddhist traditions, particularly Tibetan dream yoga, sleep quality and position are especially important. Sleeping on the left side not only reduces snoring and breathing disruptions, but may also promote more vivid and memorable dreams, according to some practitioners. This creates favorable conditions for working with dreams as part of the spiritual path. Traditional Buddhist approaches to health often emphasize working with the natural tendencies of the body rather than fighting against them. This principle applies to sleep as well. Rather than using artificial means to suppress snoring, practitioners are encouraged to address the root causes through mindful positioning of the body. This represents a sustainable, long-term approach to improving sleep quality. The peace that comes from quiet, undisturbed breathing during sleep extends beyond just the physical benefits. Many Buddhist teachers point out that the quality of our breath reflects and influences our mental state. Just as agitated breathing accompanies and reinforces agitated thoughts, calm and quiet breathing both reflects and supports a tranquil mind. By reducing snoring and breathing disruptions during sleep, we create conditions that support mental tranquility. For busy people in the modern world, sleep often becomes a neglected aspect of health. Buddhist wisdom offers a reminder that sleep quality is not a luxury, but a necessity for both physical health and mental clarity. The simple practice of sleeping on your left side represents accessible wisdom that anyone can apply, regardless of their familiarity with Buddhist traditions or formal meditation practice. By addressing snoring and breathing quality through sleep position, we acknowledge the interconnection between all aspects of our health. This holistic understanding that how we breathe affects how we sleep, which affects how we think and feel, reflects the Buddhist principle of interdependence. Through this simple adjustment to sleep position, we honor the intricate connections between body, breath, and mind that form the foundation of integrated well-being. Looking beyond breathing patterns and purification processes, another significant benefit of sleeping on your left side involves proper spinal alignment. The human spine has a natural S-curve when viewed from the side, And finding sleeping positions that maintain this natural alignment is crucial for both immediate comfort and long-term spinal health. Left side sleeping, especially when done with proper support, provides an excellent way to maintain this natural alignment throughout the night. When you sleep on your left side with a pillow of appropriate height under your head and neck, your spine remains in a neutral position from head to tailbone. This position is further enhanced when you place a small pillow or cushion between your knees, which helps keep your hips aligned and prevents your upper leg from pulling your spine out of alignment. This full body alignment reduces pressure points and minimizes stress on the vertebrae, discs, and surrounding muscles. The benefits of maintaining proper spinal alignment during sleep are substantial. Your spine houses and protects your spinal cord, which is the main highway of your nervous system. When the spine is properly aligned, nerve signals can travel efficiently throughout your body. Misalignment, on the other hand, can lead to pinched nerves, muscle tension, and a cascade of problems that might manifest as pain, numbness, or even dysfunction in organs innervated by affected nerves. Good spinal alignment during sleep also allows your back muscles to fully relax and recover. Throughout the day, these muscles work constantly to support your posture against gravity. Sleep is their opportunity to truly rest, but this can only happen effectively when the spine is properly supported and positioned. Left side sleeping provides this support naturally, without requiring elaborate arrangements of multiple pillows or specialized equipment. In Buddhist meditation traditions, practitioners are taught to sit with a straight spine, not rigidly stiff, but naturally upright. This posture is often described using the image of stacking the vertebrae like coins, creating a straight but relaxed column that allows energy to flow freely. The emphasis is on finding a middle ground between excessive tension and excessive laxity, a physical embodiment of the middle way teaching that is central to Buddhist philosophy. This concept of the middle way, Madhyamaka in Sanskrit, represents one of the Buddha's core teachings. After trying both extreme asceticism and indulgence in sensual pleasures, the Buddha discovered that neither extreme led to awakening. Instead, he found that the path to enlightenment lay in a balanced approach that avoided these extremes. This principle extends beyond spiritual practice to include practical aspects of life, including how we care for our bodies. When applied to sleep posture, the middle way suggests finding a position that is neither too rigid nor too collapsed, exactly what proper left side sleeping offers. With appropriate support, this position allows the spine to maintain its natural curves without forcing it into an unnatural shape. It provides enough support to prevent collapse while allowing the muscles to fully relax. This balance promotes both comfort during sleep and spinal health over time. Throughout Buddhist history, teachers have emphasized that caring for the body is not separate from spiritual practice, but forms an essential foundation for it. The body is seen as a vehicle for awakening, deserving of appropriate care and attention. Just as you would maintain a car that needs to make a long journey, practitioners are encouraged to maintain their bodies as vehicles for the journey of spiritual development. This balanced approach to bodily care extends to sleep, which comprises about 1/3 of our lives. Rather than viewing sleep as merely a biological necessity or an unconscious state of no spiritual value, Buddhist traditions recognize it as an important part of a holistic approach to well-being. The position we sleep in affects not only our physical comfort, but also our energy levels, mental clarity, and emotional balance during waking hours. Monks and nuns in Buddhist monasteries often receive specific instructions about sleep positions as part of their training. These instructions typically emphasize positions that support health without indulging in excessive comfort that might lead to oversleeping or lethargy. The left side sleeping position, sometimes called the lion posture in reference to how the Buddha himself is said to have slept, represents this balanced approach. Many people with back pain discover that sleeping on their left side with proper support provides relief where other positions fail. This is because side sleeping maintains the natural curve of the spine while taking pressure off sensitive areas. For those with conditions like sciatica, herniated discs, or spinal stenosis, this position often allows for pain-free rest where back or stomach sleeping might exacerbate symptoms. Even for those without specific back problems, maintaining proper spinal alignment during sleep helps prevent future issues. Our bodies are constantly rebuilding and repairing themselves, and the positions we maintain for hours during sleep influence how these processes unfold. By supporting proper alignment night after night, we help ensure that these ongoing maintenance processes work in our favor rather than gradually reinforcing problematic patterns. Modern research into the biomechanics of sleep confirms what traditional wisdom has long suggested: that sleep position significantly affects spinal health. Studies using pressure mapping and motion analysis show that side sleeping with proper support distributes weight more evenly and reduces harmful pressure points compared to other positions. This scientific validation of traditional practices highlights the practical wisdom embedded in these ancient recommendations. One particularly interesting aspect of left-side sleeping is how it helps the spine maintain its natural rotational capacity. Throughout the day, our spines need to rotate as we move and navigate our environment. During sleep, maintaining a position that allows slight natural rotation rather than forcing the spine to remain completely flat helps preserve this important mobility. The left-side sleeping position, especially with the upper knee slightly bent and supported, provides just the right amount of gentle rotation. Beyond spinal alignment, sleeping on your left side also offers remarkable benefits for circulation throughout your entire body. The human circulatory system is a vast network of blood vessels that transport oxygen, nutrients, and hormones to every cell while removing carbon dioxide and waste products. How efficiently this system functions affects everything from your energy levels to your ability to heal and recover from illness or injury. Left-side sleeping creates ideal conditions for blood circulation due to the anatomy of your cardiovascular system. Your heart pumps oxygenated blood out through the aorta, the largest artery in your body, which curves to the left as it descends from the heart. When you sleep on your left side, you're working with gravity to help blood flow more efficiently through this major vessel and throughout the rest of your circulatory system. This position is particularly beneficial for the return circulation through your veins back to your heart. Veins have a harder job than arteries because they must work against gravity to return blood from your extremities to your heart. When you sleep on your left side, you reduce the workload on certain major veins, including the inferior vena cava, which returns blood from the lower body to the heart. This makes the return circulation more efficient, reducing the work your circulatory system must do during rest. Improved circulation during sleep has far-reaching effects throughout your body. Your tissues receive more consistent oxygen and nutrient delivery, which supports cellular repair processes that are particularly active during sleep. Better circulation also means more efficient removal of metabolic waste products from your tissues, complementing the lymphatic drainage we discussed earlier. For people with certain circulatory conditions like varicose veins or edema, swelling due to fluid retention, left-side sleeping can provide significant relief. By reducing pressure on major veins and improving overall circulatory efficiency, this position helps prevent blood from pooling in the legs and feet, which is a common problem for people who spend much of their day sitting or standing. In traditional Buddhist medical systems, particularly those developed in Tibet, there's a sophisticated understanding of how energy moves through the body. These systems describe subtle channels called nadis through which life energy flows, influencing both physical health and states of consciousness. While these energy channels aren't visible to the naked eye, they often correspond to pathways of blood vessels and nerve networks that modern medicine recognizes. According to these traditional systems, sleeping on the left side helps balance the flow of energy through major channels on both sides of the body. The right side of the body is associated with active, solar energy, Pingala Nadi, while the left side is associated with receptive, lunar energy, Ida Nadi. By sleeping on the left side, practitioners activate the solar channel while allowing the lunar channel to rest, creating a balanced energy flow. This balanced energy circulation is believed to have positive effects on physical health, emotional stability, and mental clarity. When energy flows freely and harmoniously through these channels, practitioners report experiencing greater vitality, more stable moods, and clearer thinking. Blockages or imbalances in these channels, on the other hand, are associated with various physical and mental disturbances. Modern science may not use the same terminology of energy channels, but research increasingly confirms the importance of circadian rhythms and the body's internal timing systems for overall health. These rhythms influence hormone production, body temperature, and numerous physiological processes. By supporting healthy circulation through proper sleep positioning, we help maintain these natural rhythms and timing systems. Circulation affects brain function in particularly important ways. The brain receives about 20% of the body's blood flow despite accounting for only about 2% of body weight. Better circulation during sleep ensures your brain receives optimal oxygen and glucose, which it needs to perform critical maintenance and memory consolidation functions that occur primarily during sleep. The heart itself also benefits from improved circulation during left-side sleeping. When circulation is efficient, the heart doesn't have to work as hard to pump blood throughout the body. This reduced workload gives your heart muscle more opportunity to rest and recover during sleep. Over time, this can contribute to better heart health and potentially reduce risk factors for cardiovascular disease. For pregnant women, left-side sleeping offers special circulatory benefits. This position enhances blood flow to the placenta, ensuring the developing baby receives optimal oxygen and nutrients. It also prevents the weight of the growing uterus from pressing on the inferior vena cava, which can otherwise reduce blood return to the mother's heart and cause dizziness or low blood pressure. The circulatory benefits of left-side sleeping extend to the digestive system as well, creating a virtuous cycle of improved function. Better blood flow to the digestive organs supports their nighttime repair and maintenance processes. Meanwhile, more efficient digestion, which left-side sleeping also promotes, as we discussed earlier, reduces inflammation and strain on the circulatory system, allowing it to function more efficiently. Traditional Buddhist practitioners recognize these interconnections between different bodily systems long before modern medicine mapped out the details. Their holistic approach to health understood that supporting one system, like circulation, created positive effects throughout the entire body and mind. This wisdom remains relevant today, as we rediscover the importance of addressing health from a systems perspective rather than treating each bodily function in isolation. By adopting left-side sleeping as a regular practice, you're supporting both your structural alignment and your circulatory health, creating a foundation for overall well-being that extends far beyond the hours you spend asleep. This simple adjustment to sleeping position represents the kind of practical wisdom that Buddhist traditions have always emphasized, accessible ways to work with natural laws to support health, clarity, and balanced energy throughout daily life. Beyond supporting spinal alignment and circulation, sleeping on your left side provides another significant benefit. It relieves pressure on your vital organs, allowing them to function optimally during rest. Your body houses numerous organs that work constantly to keep you alive and healthy, and the position you sleep in can either support or hinder their function. Left-side sleeping creates ideal conditions for many of these organs to operate efficiently without unnecessary strain. Consider your liver, the largest internal organ in your body, which sits primarily on the right side of your abdominal cavity. This powerhouse organ performs hundreds of essential functions, including detoxifying your blood, producing bile for digestion, storing vitamins, and regulating blood sugar. When you sleep on your left side, you're taking pressure off your liver, allowing blood to flow more easily through this organ and supporting its critical nighttime detoxification processes. Your heart also benefits from reduced pressure during left-side sleeping. As we discussed earlier regarding circulation, This position works with gravity to help blood flow more efficiently. But beyond improving circulation, left side sleeping also prevents the weight of other organs from pressing against the heart itself. This is particularly important because your heart works constantly without rest, and anything that reduces its workload can contribute to long-term cardiac health. The lungs experience more balanced perfusion, blood flow, when you sleep on your left side, while right side sleeping tends to direct more blood flow to the right lung. Left side sleeping promotes more even distribution between both lungs. This balanced perfusion supports optimal oxygen exchange throughout the night, enhancing the quality of your rest and providing better oxygenation to all your tissues. Your pancreas, which produces digestive enzymes and insulin, sits toward the back of your abdominal cavity behind your stomach. Left side sleeping reduces pressure on this vital organ, potentially supporting both its digestive and endocrine functions. Given the pancreas's crucial role in regulating blood sugar, supporting its optimal function through proper sleep positioning may have far-reaching effects on energy regulation and metabolic health. The spleen, located on the upper left side of your abdomen, benefits directly from left-side sleeping. This often overlooked organ plays vital roles in filtering your blood, recycling old red blood cells, and supporting immune function. When you sleep on your left side, gravity helps blood flow more efficiently through your spleen, supporting these important functions and potentially enhancing immune activity during rest. For pregnant women, left side sleeping takes pressure off the uterus, preventing it from compressing major blood vessels that could restrict circulation to both mother and baby. This position also reduces pressure on the kidneys, which already face increased demands during pregnancy. By supporting optimal kidney function, left-side sleeping helps manage fluid balance and blood pressure, reducing the risk of complications during pregnancy. The principle of relieving pressure on vital organs aligns perfectly with the Buddhist concept of non-harm, ahimsa in Sanskrit, avihimsa in Pali. This fundamental ethical principle appears throughout Buddhist teachings, beginning with the recognition that all beings wish to avoid suffering and experience happiness. While ahimsa is typically discussed in terms of our relationships with other beings, Buddhist traditions also apply this principle to how we treat our own bodies. In Buddhist practice, the body is viewed as a precious vehicle that allows us to practice the Dharma and benefit others. Caring for this vehicle through mindful choices, including sleep position, represents a form of non-harm directed toward oneself. By choosing a sleep position that reduces strain on vital organs, we're practicing a subtle but meaningful form of self-care that reflects this principle of non-harm. The Buddha often taught about the importance of mindfulness regarding the body, including awareness of postures and their effects. In the Satipatthana Sutta, a foundational text on mindfulness practice, the Buddha instructs practitioners to maintain awareness of the body's positions and movements, whether walking, standing, sitting, or lying down. This teaching encourages practitioners to notice how different postures affect their physical and mental states. Traditional Buddhist medical texts, particularly those from Tibet, contain detailed instructions about how to care for the body's organs through diet, behavior, and physical positioning. These texts reflect a sophisticated understanding of how external factors influence internal function, including how the position of the body affects the operation of various organs. The recommendation to sleep on the left side appears in many of these traditional medical systems. By reducing pressure on vital organs during sleep, we support not just their immediate function but also their long-term health. Many organ systems perform critical repair and regeneration processes during sleep. When these organs are free from unnecessary pressure, these restorative processes can occur more efficiently, potentially extending the healthy, functional lifespan of these essential systems. The interconnectedness of organ systems means that supporting one organ often benefits others. For example, when the liver functions efficiently during sleep, It produces appropriate amounts of bile that help the gallbladder and intestines perform their digestive functions. When the heart works more efficiently, all organs receive better blood supply. This interconnectedness reflects the Buddhist understanding of dependent origination, pratityasamutpada in Sanskrit, the principle that all phenomena arise in dependence upon multiple causes and conditions. Modern research increasingly confirms what traditional wisdom has long suggested, that sleep position affects organ function in meaningful ways. Studies using imaging techniques have shown how the position of the body influences blood flow to different organs, pressure relationships within the abdominal and thoracic cavities, and even the activity levels of various organs. This scientific validation highlights the practical wisdom embedded in traditional recommendations about sleep positioning. By making the simple choice to sleep on your left side, you're making a decision that supports your organ's natural function and longevity. This choice requires no special equipment, supplements, or complicated regimens, just awareness of how positioning affects your internal physiology and the intention to support optimal function through proper alignment. This accessibility reflects the practical wisdom of Buddhist health traditions, which emphasize working with natural laws rather than against them. In addition to supporting organ function, sleeping on your left side facilitates another crucial but lesser-known process: the clearance of metabolic waste from your brain. Recent scientific discoveries have revealed that your brain has its own specialized waste removal system, and the position you sleep in significantly affects how well this system functions. Scientists have identified what they call the glymphatic system, a network of vessels that surrounds blood vessels in the brain and uses cerebrospinal fluid to flush away waste products. This system becomes dramatically more active during sleep, increasing its waste clearance activity by as much as 60% compared to waking hours. It's as if your brain has its own dedicated cleaning crew that gets to work primarily when you're asleep. This cleaning process is crucial because your brain produces substantial metabolic waste during its constant activity. Throughout the day, your brain cells generate byproducts that can become toxic if allowed to accumulate. These include proteins like beta amyloid, which has been linked to Alzheimer's disease when it builds up to form plaques between neurons. The glymphatic system helps prevent this buildup by efficiently removing these waste products during sleep. Research suggests that sleeping on your side, particularly the left side, may enhance this crucial brain cleaning function. In animal studies, the glymphatic system worked most efficiently in the lateral side sleeping position compared to sleeping on the back or stomach. Scientists believe this is because the position affects how cerebrospinal fluid flows through brain tissues, with side sleeping creating optimal conditions for efficient flow and waste removal. This enhanced brain waste clearance has profound implications for cognitive health, both short-term and long-term. In the short term, efficient removal of metabolic waste contributes to that refreshed feeling and mental clarity you experience after a good night's sleep. When waste products are effectively cleared, brain cells can function optimally, supporting clear thinking, stable mood, and effective learning. In the longer term, efficient brain waste clearance may help protect against neurodegenerative conditions. Research has found connections between sleep disturbances, reduced glymphatic function, and increased risk of conditions like Alzheimer's disease. By sleeping in a position that supports optimal waste clearance, you may be contributing to your brain's long-term health and resilience against age-related cognitive decline. This scientific understanding of brain cleansing during sleep has fascinating parallels with traditional Buddhist concepts of mental purification. While traditional Buddhist texts obviously didn't describe the glymphatic system in modern scientific terms, they recognized the transformative potential of sleep for mental clarity. Many Buddhist meditation traditions include specific practices for maintaining awareness during the transition to sleep and for working with dreams to enhance mental clarity. In the Tibetan Buddhist tradition, sleep is sometimes referred to as little death, recognizing it as a time when ordinary waking consciousness dissolves. creating an opportunity to experience more subtle states of awareness. Practitioners are encouraged to maintain mindfulness as they fall asleep, transforming sleep from an unconscious state into a continuation of practice. The quality of sleep, including sleep position, is seen as influencing how effectively this practice can be maintained. Traditional Buddhist teachings often describe how mental obscurations, patterns of thought that cloud our natural clarity, can be purified through various practices. Modern understanding of the brain's physical cleaning mechanisms during sleep offers a fascinating physiological parallel to this concept of mental purification. Just as meditation practices help clear mental obscurations, proper sleep positioning helps clear physical waste products that can interfere with optimal brain function. The Buddha often described the mind as naturally luminous, with defilements being temporary obscurations rather than inherent qualities of mind itself. This view suggests that mental clarity is our natural state when impediments are removed. Similarly, the brain functions with optimal clarity when metabolic waste products are effectively cleared. By supporting this clearance through proper sleep positioning, we're creating conditions that allow natural clarity to manifest. Buddhist meditation practices aim to develop greater awareness of mental processes, including how different states arise and pass away. This increased awareness often leads practitioners to notice how sleep quality affects their mental clarity and emotional balance during waking hours. Many experienced meditators become quite sensitive to factors that enhance or diminish mental clarity, including sleep position, sleep duration, and sleep quality. Traditional Buddhist monasteries typically maintain schedules that allow for adequate but not excessive sleep, recognizing that both sleep deprivation and oversleeping can cloud mental clarity. The quality of sleep is considered just as important as its quantity. Proper sleep positioning represents one aspect of sleep quality that practitioners can readily adjust to support optimal brain function and mental clarity. Modern neuroscience increasingly validates this traditional emphasis on sleep quality for cognitive function. Research shows that during quality sleep, the brain not only clears waste, but also consolidates learning, processes emotional experiences, and strengthens neural connections that support skillful functioning. These processes are optimized when sleep occurs in conditions that support the brain's natural mechanisms, including appropriate sleep positioning. By adopting left-side sleeping as a regular practice, you're not just supporting your vital organs, but also enhancing your brain's natural cleaning processes. This creates a foundation for clearer thinking, more balanced emotions, and potentially greater resilience against cognitive decline. Once again, this simple adjustment to sleeping habits represents practical wisdom that bridges ancient understanding and modern science, offering accessible benefits to anyone willing to make this small but significant change to their sleep routine. Beyond supporting brain waste clearance, sleeping on your left side offers benefits that connect to subtle energy systems recognized in various Buddhist meditative traditions, particularly those found in Tantric Buddhism. These traditions describe an intricate network of energy channels running throughout the body that influence both physical health and states of consciousness. Two primary channels, known as Ida and Pingala in Sanskrit, play especially important roles in these systems, and your sleep position can affect their balance. These energy channels might sound esoteric, but they correspond closely with aspects of our nervous system recognized by modern science. The Ida Nadi, or lunar channel, runs along the left side of the spine and is associated with cooling, calming, receptive energy. It connects to the right hemisphere of the brain and governs more intuitive, creative functions. The Pingala Nadi, or solar channel, runs along the right side of the spine and carries warming, activating, projective energy. It connects to the left hemisphere of the brain and governs more analytical, logical functions. In Tantric Buddhist practices, particularly those preserved in Tibetan traditions, practitioners work to balance these energy channels to achieve optimal states for meditation and insight. When these channels are balanced, a third central channel, Sushumna, becomes activated, creating conditions for deeper meditative experiences and insights. This balanced state supports both physical health and mental clarity. Interestingly, sleeping on your left side is believed to naturally help balance these energy channels. When you lie on your left side, you're actually activating the right side solar channel, Pingala, while allowing the left side lunar channel, Ida, to rest. This creates a natural balancing effect that continues throughout your sleep cycle. For people who tend toward too much cooling or receptive energy, which might manifest as lethargy, overthinking, or emotional sensitivity, this balancing can be especially beneficial. Tibetan Buddhist medical texts describe how imbalances in these energy channels can manifest as various physical and mental disturbances. Too much Ida energy might result in coldness, depression, or excessive dreaminess, while too much Pingala energy might cause overheating, irritability, or restlessness. By sleeping on the left side, practitioners naturally counteract potential imbalances, creating more favorable conditions for both physical health and meditation practice. This understanding of subtle energy channels emerged from the deep meditative experiences of practitioners who spent years observing the interplay between body position, breath, mental states, and energy flows. While modern science might use different terminology, research increasingly recognizes connections between body positioning, autonomic nervous system function, and brain hemisphere activity that parallel these traditional understandings in many ways. For instance, research has shown that nostril dominance alternates throughout the day, with one nostril becoming more open than the other in cycles. This alternation correlates with shifts in brain hemisphere activity and with functions traditionally associated with Ida and Pingala nadis. When the right nostril is dominant, corresponding to Pingala activation, people tend to perform better at logical tasks. When the left nostril is dominant, corresponding to Ida activation, creative abilities are enhanced. Sleep position affects these patterns of nostril dominance and brain hemisphere activity. When you sleep on your left side, you naturally increase airflow through your right nostril, which activates the left brain hemisphere and solar energy, exactly what traditional texts describe as the effect of this sleep position on the nadis. This physiological effect helps explain why many people report feeling more balanced and energized after sleeping on their left side. In Vajrayana, tantric Buddhist practices, practitioners learn to consciously work with these energy channels through visualization, breath control, and physical postures. These formal practices require significant training and are typically done during waking hours. However, the position we maintain during sleep, roughly 1/3 of our lives, naturally influences these same energy systems without requiring conscious intervention. This makes sleep position a particularly accessible way to work with these subtle energies. Monastics in traditions that include these energy practices often receive specific instructions about sleep positions as part of their training. These instructions aim to support both physical health and the subtle energy balance that facilitates their meditation practice. The left side sleeping position is frequently recommended, especially for practitioners who need to balance excess Ida energy or who are working with specific visualizations involving the chakras and nadis. Modern practitioners of Buddhist meditation, even those not explicitly working with subtle energy practices, often report benefits from adopting traditional sleep positions. Many find that left-side sleeping contributes to a more balanced feeling upon waking and supports more stable energy throughout the day. This balance creates favorable conditions for maintaining mindfulness and concentration during formal meditation sessions and daily activities. For people with certain conditions, this balancing effect can be particularly beneficial. Those who struggle with anxiety or overactive minds might find that the activation of Ida energy helps calm their system, while those dealing with lethargy or depression might benefit from the activation of Pingala energy. The beauty of this approach is that it works with natural processes rather than against them, gently nudging the system toward balance rather than forcing dramatic shifts. The subtle energy effects of sleep position highlight how seemingly minor choices can influence our overall state in meaningful ways. This reflects the Buddhist understanding that small causes can produce significant effects due to the interconnected nature of all phenomena. By making simple adjustments to how we position our bodies during sleep, we potentially influence subtle aspects of our physiology that affect everything from our energy levels to our emotional balance to our capacity for clear awareness. Beyond balancing subtle energies, sleeping on your left side also connects to another core Buddhist teaching: the truth of impermanence. This fundamental principle, that all conditioned things are constantly changing, might seem unrelated to sleep position at first glance. However, developing awareness of how our body position affects our physical and mental states actually helps us recognize impermanence in direct, experiential ways. Most people are unconscious during sleep, unaware of their body position or its effects. By consciously choosing to sleep on your left side, you're bringing mindfulness to an activity that usually happens automatically. This conscious choice represents a form of practice that extends mindfulness into periods usually dominated by unawareness. It's a practical way of acknowledging that every position and activity, even during sleep, has consequences that ripple through our experience. Buddhist practice emphasizes continuous awareness throughout all activities, not just during formal meditation. The Satipatthana Sutta, a key text on mindfulness practice, instructs practitioners to maintain awareness whether walking, standing, sitting, or lying down. This teaching recognizes that all postures and activities provide opportunities for practice. By bringing conscious attention to your sleep position, you're extending this continuous awareness into the threshold of sleep. Our body is constantly changing, cells die and are replaced, hormones fluctuate, and systems adjust to internal and external conditions. Sleep position affects how these changes unfold during roughly 1/3 of our lives. By choosing a position that supports optimal function, we're not preventing change, which would be impossible, but rather creating conditions for changes that support health and clarity rather than degradation and confusion. The Buddha often described ignorance as a kind of sleep and awakening as, well, waking up to reality as it is. When we sleep without awareness of how our position affects us, we're doubly asleep, both literally and metaphorically. By bringing conscious choice to sleep position, we're slightly reducing this ignorance, acknowledging that our choices matter even during periods of unconsciousness. Many Buddhist practitioners begin and end their day with specific intentions and reflections. Traditional evening practices might include reflecting on impermanence, recognizing that there's no guarantee of waking up the next morning. This reflection isn't meant to be morbid, but rather to inspire practitioners to make wise choices and to practice with diligence. Choosing a beneficial sleep position can be part of this intentional approach to practice, recognizing that each night's rest influences the quality of the next day's experience. The quality of awareness we bring to the transition between waking and sleeping states affects how we experience impermanence in all aspects of life. When we fall asleep with awareness of our body position and its effects, we're more likely to notice other subtle transitions throughout our day. This increased sensitivity to change helps us recognize how constantly all phenomena are shifting, supporting the direct realization of impermanence that Buddhist practice aims to cultivate. Sleep itself provides a powerful opportunity to observe impermanence. As we drift from waking consciousness through hypnagogic states into various sleep stages, we experience dramatic changes in awareness. By establishing a stable, beneficial physical position as we enter sleep, we create a kind of anchor that helps maintain some continuity of awareness through these transitions. Many meditation traditions teach that maintaining awareness through these transitions can lead to profound insights. Left-side sleeping also has practical implications for our experience of impermanence in daily life. When our sleep is restful and our physiological functions are well supported, we typically wake feeling refreshed and clear-headed. This clarity allows us to observe the constantly changing nature of our thoughts, emotions, and sensations with greater precision. Conversely, poor sleep often clouds our awareness, making it harder to recognize the subtle impermanence of mental phenomena. The Buddha taught that all conditioned things have three characteristics: impermanence, unsatisfactoriness when clung to, and not self, lacking independent existence. Our body position during sleep, while seemingly minor, influences how clearly we can perceive these characteristics in our experience. By supporting optimal brain function, hormone balance, and energy flow, proper sleep positioning creates conditions that allow for clearer perception of reality as it is. Buddhist practice aims not to escape the truth of impermanence, but to fully accept and understand it. This acceptance begins with practical acknowledgement of how conditions affect our experience. By recognizing that sleep position influences our physical and mental states, we're acknowledging the conditioned nature of our experience in a practical, embodied way. This acknowledgement forms a foundation for deeper understanding of impermanence in all aspects of life. The simple practice of positioning your body mindfully as you prepare for sleep represents a practical engagement with both subtle energy principles and the truth of impermanence. It demonstrates how Buddhist wisdom can be applied to the most ordinary aspects of daily life, transforming even unconscious hours into opportunities for practice. By bringing awareness to how we position ourselves for sleep, we extend mindfulness into a third of our lives typically spent in unawareness, creating a more continuous thread of practice throughout our entire experience. The mindful approach to sleep position extends its benefits to a particularly important period in human life: pregnancy. For expectant mothers, sleeping on the left side isn't just beneficial, it's often specifically recommended by healthcare providers as the optimal position throughout pregnancy, especially in the second and third trimesters. This recommendation has strong medical backing and connects interestingly with Buddhist perspectives on the prenatal period. When a pregnant woman sleeps on her left side, she creates ideal circulatory conditions for both herself and her developing baby. This position prevents the weight of the growing uterus from compressing the inferior vena cava, a major vein that returns blood from the lower body to the heart. Compression of this vein can reduce blood flow to the heart, which in turn decreases cardiac output and blood flow to the placenta. By sleeping on her left side, an expectant mother ensures optimal blood circulation to this crucial organ that provides oxygen and nutrients to the developing baby. This improved circulation has multiple benefits. It enhances the delivery of nutrients and oxygen to the developing baby, supporting healthy growth and development. It also improves maternal kidney function by increasing blood flow to these organs, which helps with the increased filtering demands of pregnancy. Better kidney function means more efficient removal of waste products and better management of fluids, potentially reducing pregnancy complications like swelling and high blood pressure. Left side sleeping during pregnancy also improves digestive function, which is especially important as many expectant mothers experience digestive discomfort due to hormonal changes and the physical pressure of the growing uterus on digestive organs. By supporting better digestion, this position can reduce complications like constipation and acid reflux, which are common during pregnancy. Beyond these physical benefits, the prenatal period holds special significance in Buddhist understanding of human development. In Buddhist texts like the Garbhavakranti Sutra, Sutra on Entry into the Womb, there are detailed descriptions of consciousness entering the womb and the gradual development of the fetus. These teachings recognize the prenatal period as a crucial time when the foundation for a person's future life is established. According to these traditional views, the developing baby is not just a physical entity but also a continuation of a consciousness stream from previous existences. The quality of the prenatal environment, including the mother's physical health, emotional state, and even her thoughts, is believed to influence how this consciousness settles and develops in its new incarnation. By supporting optimal physical conditions through practices like left-side sleeping, a mother creates favorable circumstances for this important developmental period. Many traditional Buddhist cultures have specific practices and observances for pregnancy that reflect this understanding. Expectant mothers are often encouraged to maintain peaceful thoughts, listen to spiritual teachings or soothing music, avoid disturbing or violent content, and practice gentle forms of meditation. These recommendations aim to create not just physical but also psychological and spiritual conditions that support favorable development. In Tibetan Buddhist traditions particularly, there are specific practices for expectant mothers designed to create auspicious connections for the incoming consciousness. Some of these include visualizations of light and purity surrounding the womb, recitation of specific mantras believed to benefit the developing baby, and making aspirations for the baby's future positive development and connection with spiritual teachings. The maternal blood circulation supported by left-side sleeping creates a physical parallel to these spiritual practices. Both aim to create optimal conditions for development, just as the mother's blood carries physical nutrients to nourish the baby's body. Buddhist tradition speaks of the mother's state of mind and spiritual practice, creating non-physical nourishment for the developing consciousness. Modern medical research increasingly recognizes the profound influence of prenatal conditions on lifelong health outcomes. Studies in the field of epigenetics show that the prenatal environment can affect gene expression in ways that influence health decades later. Stress hormones, nutritional status, and environmental exposures during pregnancy can create lasting impacts on a child's physical and mental health predispositions. This scientific understanding offers a fascinating parallel to the Buddhist view that prenatal conditions influence not just physical development but deeper aspects of a person's life trajectory. For women experiencing difficult pregnancies, the simple practice of sleeping on the left side can provide noticeable relief from common discomforts while also supporting their baby's development. This practice exemplifies the practical wisdom found in Buddhist approaches to health, working with the body's natural functions rather than against them, and recognizing that simple adjustments can sometimes provide significant benefits. The attention to proper positioning during pregnancy also reflects the Buddhist emphasis on mindfulness of the body. By bringing conscious awareness to how she positions her body for sleep, an expectant mother extends her care for her baby into the hours when she would otherwise be unconscious. This practice becomes a form of around-the-clock mindfulness and care that benefits both mother and child. In some Buddhist traditions, birth is viewed as potentially traumatic for the incoming consciousness, which experiences the transition from one state of existence to another. Creating optimal conditions during pregnancy, including supportive sleep positions, is seen as a way to ease this transition and create a more favorable rebirth experience. This care extends beyond physical health to include subtle aspects of consciousness that modern medicine is only beginning to explore, whether approached from a spiritual perspective or a purely medical one. The benefits of left-side sleeping during pregnancy highlight how this simple practice supports optimal conditions during a crucial developmental period. By adopting this position, expectant mothers participate in a tradition of care that spans cultures and epochs, creating the best possible start for the next generation. Beyond pregnancy, many adults experience uncomfortable digestive symptoms like heartburn and acid reflux that can significantly impact sleep quality. These common complaints affect millions of people worldwide, with symptoms ranging from mild discomfort to severe pain that disrupts sleep and daily activities. Here too, sleeping on your left side offers remarkable benefits that connect to Buddhist approaches to addressing suffering. Heartburn occurs when stomach acid flows back up into the esophagus, causing that characteristic burning sensation in the chest. It's particularly common after large meals, when lying down, or during pregnancy, when the growing uterus puts pressure on the stomach. While many people turn to medications for relief, sleep position offers a drug-free approach that works with the body's natural anatomy. When you sleep on your left side, your stomach sits lower than your esophagus due to the natural curvature of the digestive tract. This positioning uses gravity to help keep stomach contents where they belong, in the stomach, rather than flowing back up into the esophagus where they cause irritation. It's a simple physical solution that works with your body's design rather than trying to alter its chemistry with medications. This positioning also helps the digestive tract maintain its natural flow direction. Food moves through your digestive system in a specific direction, and left-side sleeping supports this flow pattern. Your stomach naturally curves to the left, so this position allows it to hang naturally, keeping its contents lower than the esophageal opening and reducing the likelihood of reflux. For many people with chronic heartburn or GERD, gastroesophageal reflux disease, making this simple change to sleep position provides significant relief without side effects. While medications like proton pump inhibitors and antacids can be effective, they sometimes cause other issues with long-term use. Sleep position adjustment offers a complementary approach that may reduce reliance on these medications. This natural approach to addressing a common source of suffering connects directly with Buddhist principles about working with causes and conditions rather than merely treating symptoms. The Buddha's teachings begin with the recognition of dukkha, often translated as suffering or unsatisfactoriness, and proceed to identify its causes and the path to its cessation. This approach emphasizes understanding the origin of problems rather than just suppressing their manifestations. In the case of heartburn, the suffering has identifiable causes, the backflow of stomach acid into the esophagus. Rather than simply neutralizing the acid, treating the symptom, sleeping on the left side addresses a key condition that allows the acid to backflow in the first place, addressing the cause. This approach mirrors the Buddha's emphasis on addressing root causes rather than just managing symptoms. Traditional Buddhist medical systems, particularly those developed in Tibet, often emphasize working with the body's natural functions rather than overriding them. These approaches typically start with the least invasive interventions, adjustments to diet, behavior, and physical positioning, before proceeding to stronger interventions like herbal remedies or more intensive treatments. Sleep position represents this kind of minimal, natural intervention that works with rather than against bodily systems. Buddhist approaches to health also recognize the connection between physical discomfort and mental states. When we experience physical pain or discomfort like heartburn, it often leads to mental suffering in the form of frustration, worry, or dwelling on the discomfort. By addressing the physical cause through proper positioning, we simultaneously reduce both the physical discomfort and its mental consequences, creating conditions for more peaceful sleep and clearer awareness upon waking. The Four Noble Truths, the Buddha's core teaching, outline a systematic approach to addressing suffering. They involve recognizing suffering, understanding its causes, realizing that cessation is possible, and following the path that leads to that cessation. Applied to a condition like heartburn, this might mean acknowledging the discomfort, understanding that it comes from acid reaching the esophagus, recognizing that prevention is possible, and implementing practical solutions like appropriate sleep positioning. Traditional Buddhist monasteries typically provide practical instructions for managing common physical discomforts alongside more formal meditation teachings. This reflects the understanding that addressing basic physical needs creates a foundation for deeper practice. Just as modern meditation retreats might include guidance on proper sitting posture to prevent back pain during meditation, traditional training would include practical advice for managing common ailments like digestive discomfort. The Buddha himself was known for his pragmatic approach to teaching, offering different instructions to different people based on their specific needs and conditions. This pragmatism extends to addressing physical suffering as well. Rather than prescribing a one-size-fits-all solution, Buddhist approaches typically recognize individual differences and encourage experimentation to find what works best for each person. While left-side sleeping benefits many people with heartburn, individuals are encouraged to notice its effects in their own experience rather than simply taking it on authority. This experimental approach exemplifies the Buddha's teaching to come and see, ehipassiko in Pali, to try things for yourself and observe the results rather than accepting them solely on faith. People with heartburn who try left-side sleeping can directly observe whether it reduces their symptoms. providing immediate, experiential feedback about its effectiveness for their particular condition. Buddhist practice emphasizes cultivating awareness of cause and effect in all aspects of life. By noticing how sleep position affects digestive comfort, we develop greater sensitivity to how our choices influence our experience. This awareness naturally extends to other areas, helping us recognize how various factors, from what and when we eat to how we position our bodies, contribute to comfort or discomfort. For busy people in the modern world, simple and accessible approaches to managing common ailments are particularly valuable. Left-side sleeping represents this kind of accessible wisdom, a straightforward adjustment that requires no special equipment, medications, or extensive training. This accessibility reflects the Buddhist value of making beneficial practices available to everyone, not just those with special resources or circumstances. By addressing common sources of physical discomfort like heartburn through natural methods like sleep positioning, we create conditions for more restful sleep, which in turn supports mental clarity and emotional balance during waking hours. This creates a virtuous cycle where physical comfort supports mental well-being, which in turn informs choices that promote further physical health. This integrated approach to well-being reflects the holistic understanding found throughout Buddhist health traditions. Building on our understanding of how left-side sleeping helps with heartburn, it's worth exploring how this position also promotes better breathing patterns throughout the night. Respiratory function during sleep is something we rarely think about until problems arise, yet it fundamentally affects our sleep quality and overall health. The position in which we sleep significantly influences how freely and effectively we breathe, with left-side sleeping offering several distinct advantages. When you sleep on your left side, your airways tend to stay more open and unobstructed compared to back or stomach sleeping. This positioning helps keep your tongue and soft palate from collapsing backward into your throat, which is a common cause of breathing disruptions during sleep. The natural curve of your airway when lying on your left side also helps maintain a clearer passage for air to flow in and out of your lungs. For people with respiratory conditions like asthma or COPD, chronic obstructive pulmonary disease, this improved airway positioning can make a significant difference in symptom management during the night. Many people with these conditions report fewer breathing difficulties and reduced nighttime awakenings when sleeping on their left side compared to other positions. The left side sleeping position also helps reduce pressure on your lungs from other organs. When lying on your right side, your liver, the largest internal organ, can press up against your right lung, potentially restricting its expansion. On your left side, the lungs face less pressure from surrounding organs, allowing for fuller expansion with each breath. This is particularly beneficial for the right lung, which is slightly larger than the left and benefits from the freedom to expand more fully in this position. Breathing quality during sleep directly affects oxygen levels in your blood, which in turn influences countless bodily functions. When breathing is shallow or obstructed, oxygen saturation can drop, triggering stress responses and disrupting deep sleep stages. By promoting clearer airways and fuller breathing, left side sleeping helps maintain optimal oxygen levels throughout the night, supporting everything from cellular repair to brain function. In Buddhist practice, breath awareness forms the foundation of many meditation techniques. The Buddha taught anapanasati, mindfulness of breathing, as a complete path to awakening, showing how careful attention to the natural breath can develop concentration, mindfulness, and insight. While these formal practices are usually done during waking hours, the quality of breathing during sleep influences how rested and clear-minded we feel upon waking, affecting our capacity for formal practice. Traditional Buddhist meditation instructions often begin with finding a comfortable, balanced posture that supports natural breathing. This same principle applies to sleep positions. By choosing a position that facilitates optimal breathing, we're creating conditions that support both physical rest and the mental clarity that emerges from it. Even though we're not consciously practicing during sleep, our breathing patterns continue to influence our physical and mental states. The quality of our breath creates a bridge between sleep and waking states. How we breathe during sleep affects how we feel upon waking, and how we breathe during the day affects how easily we fall asleep at night. Many Buddhist practitioners incorporate breath awareness into their bedtime routine, using gentle attention to the breath as a way to transition mindfully into sleep. Left-side sleeping naturally extends this mindful approach by supporting optimal breathing throughout the night. In Tibetan Buddhist traditions, practitioners work with subtle energy practices that involve visualizing and directing the breath through energy channels in the body. While these are formal practices done during meditation, they recognize the profound influence that breath quality has on mental and physical states. By sleeping in positions that support natural breathing, practitioners create harmony between their formal practice and their unconscious hours. Traditional Buddhist medical texts describe how breath quality affects not just the lungs, but all organ systems. These texts recognize breath as a carrier of life energy that nourishes tissues throughout the body. When breathing is shallow or obstructed during sleep, this vital nourishment is diminished, potentially affecting health and vitality over time. Proper sleep positioning helps ensure this essential function continues optimally throughout the night. Modern sleep research confirms the importance of breathing quality for restorative sleep. Studies show that even mild breathing disruptions, not severe enough to be classified as sleep apnea, can fragment sleep cycles, reduce deep sleep, and increase daytime fatigue. By improving breathing mechanics, left-side sleeping helps maintain the continuity of sleep cycles that's essential for true restoration. The relationship between breathing and nervous system states is particularly important during sleep. Deep, unobstructed breathing helps activate the parasympathetic rest and digest nervous system, which governs restoration and recovery. Conversely, breathing disruptions can trigger sympathetic fight or flight responses, even without fully waking you up. These subtle stress responses can accumulate throughout the night, diminishing sleep quality and affecting daytime functioning. For people who practice dream yoga or lucid dreaming as part of their Buddhist practice, breath quality during sleep takes on additional significance. These traditions teach techniques for maintaining awareness during the dream state, using it as an opportunity for insight and practice. Practitioners report that better breathing during sleep supports clearer dreams and greater success with these practices, likely due to improved oxygen supply to the brain and reduced sleep fragmentation. By making left-side sleeping a regular practice, you're supporting optimal breathing throughout roughly 1/3 of your life, a significant contribution to overall respiratory health and function. This simple adjustment requires no special equipment or techniques, yet potentially offers profound benefits for both sleep quality and waking clarity. It's a perfect example of how mindful attention to basic physical positioning can support broader aspects of health and practice. Beyond promoting better breathing, left-side sleeping also offers specific benefits for spleen function, an organ that receives special attention in traditional Asian medicine systems, including those associated with Buddhist healing traditions. The spleen sits in the upper left portion of your abdomen, tucked just under your ribcage, and performs several crucial functions that benefit from the gravitational advantages of left-side sleeping. In Western medicine, the spleen is recognized primarily for its role in filtering blood and supporting immune function. It serves as a blood reservoir, filters out old red blood cells, and houses specific white blood cells that help fight infections. In traditional Asian medical systems, including those preserved in Buddhist monasteries, the spleen's functions are described more extensively, including transforming food into energy and maintaining proper fluid balance throughout the body. When you sleep on your left side, gravity helps blood flow more efficiently through your spleen, supporting its filtering functions. This position allows the organ to rest naturally while still performing its important work. The improved circulation through the spleen potentially enhances its immune functions, contributing to the body's natural defenses against illness. in traditional Tibetan medicine, which developed within Buddhist monastic contexts. The spleen is associated with the earth element and plays a crucial role in transforming nutrition into energy that sustains the body. This system recognizes that when the spleen functions optimally, it produces a form of refined nutritional essence that supports all other organs and tissues. Sleep position is considered one of many factors that influence how effectively the spleen performs this vital transformation. Buddhist medical texts often describe the body as an interconnected system where the functioning of each organ affects all others. The spleen holds a special place in this understanding because of its role in generating the post-digestive nutritional essence that nourishes all tissues. By supporting spleen function through proper sleep positioning, practitioners believe they're supporting the entire body's harmony and function. The spleen also plays an important role in the immune system, which becomes particularly active during sleep. The deepest stages of sleep are when the body conducts much of its immune surveillance and response work. By enhancing spleen function through left-side sleeping, you're potentially supporting these crucial immune processes during their peak activity time. Traditional Buddhist monastic medicine includes seasonal recommendations for supporting spleen function, with sleep position being one component of this care. These recommendations recognize that different organs need different types of support depending on seasonal influences, activity levels, and individual constitutions. The left-side sleeping position is particularly emphasized during transitional seasons like late summer and early fall, when traditional systems believe the spleen needs additional support. For people with certain health conditions, spleen function takes on additional importance. Conditions involving blood disorders, immune dysfunction, or digestive weaknesses may particularly benefit from practices that support optimal spleen function. While left-side sleeping alone isn't a treatment for these conditions, it represents one component of a holistic approach to supporting this important organ. Modern research on circadian rhythms and organ function offers interesting parallels to traditional understandings of organ harmonization. Studies show that different organs have peak activity times throughout the 24-hour cycle, with many cleanup and restoration processes happening during sleep hours. By supporting organs like the spleen through proper positioning during their active periods, we potentially enhance their natural rhythms and functions. The spleen's location in the left upper quadrant of the abdomen makes it particularly responsive to positioning, unlike some deeper organs that are more protected by surrounding structures. The spleen's position makes it more influenced by gravity and body positioning. This anatomical reality gives credence to the traditional emphasis on sleep position as a factor in spleen health. In Buddhist understanding, caring for individual organs is never just about physical health, but connects to broader harmony throughout the body-mind system. Traditional texts describe correspondences between organs and emotional qualities, with the spleen associated with worry and overthinking when imbalanced, and centeredness and stability when functioning well. By supporting physical organ function, practitioners believe they're also supporting balanced emotional and mental states. Many Buddhist monasteries maintain daily schedules that align with traditional understandings of organ rhythms, with activities timed to support the natural cycles of different body systems. Sleep times and positions form one element of these carefully structured routines. The left side sleeping position, recommended during evening hours when the body transitions toward rest and restoration, helps harmonize spleen function with the body's natural rhythms. Traditional Buddhist medicine recognizes that proper function of the spleen and other digestive organs creates a foundation for overall health and vitality. When these primary functions of transforming food into usable energy are working well, they create favorable conditions for all other bodily functions, from clear thinking to emotional balance to physical strength. Sleep position represents one simple yet effective way to support these foundational functions. By adopting left-side sleeping as a regular practice, you're not just supporting individual organs like the spleen, but participating in an approach to health that recognizes the profound interconnection between all bodily systems. This holistic perspective sees health not as the absence of disease, but as a harmonious functioning of interconnected systems: physical, energetic, and mental. The simple practice of mindful sleep positioning represents this integrated approach to well-being that has been preserved in Buddhist traditions for centuries and continues to offer practical benefits in our modern context. The spleen's role in maintaining bodily harmony connects closely with another key benefit of left-side sleeping: its ability to enhance the quality of meditation practice. While many people think of meditation and sleep as completely separate activities, they actually influence each other profoundly. The quality of your sleep directly affects your meditation practice, and your sleep position plays a significant role in determining that quality. When you sleep on your left side with proper support, you're creating optimal conditions for truly restorative rest. This position supports healthy circulation, breathing, digestion, and organ function, as we've discussed. When these physiological processes run smoothly during sleep, you awaken with a clearer mind and more balanced energy, ideal conditions for effective meditation practice. Many meditators notice that their morning sessions feel dramatically different depending on how well they slept the previous night. After poor sleep, the mind tends to be dull, distracted, or agitated, making it difficult to maintain focus or awareness. After quality sleep in a supportive position, meditation often feels more natural, with greater clarity and stability of attention. This difference highlights how sleep and meditation quality are inherently linked. Traditional Buddhist monastic schedules recognize this connection by carefully structuring both sleep and meditation periods for optimal effect. In many monasteries, practitioners rise before dawn for their first meditation session, taking advantage of the natural mental clarity that often accompanies early morning hours. The quality of this important morning practice depends significantly on the quality of the preceding night's rest. Sleep disruptions from poor positioning can create subtle but significant obstacles to meditation practice. When breathing is restricted during sleep, oxygen levels may drop, triggering stress responses that fragment sleep cycles. These disruptions might not fully wake you, but can prevent you from getting enough deep sleep and REM sleep, the stages most crucial for mental and emotional restoration. The resulting subtle fatigue and imbalance can manifest as obstacles during meditation. Dullness, agitation, or difficulty maintaining awareness. Left-side sleeping helps minimize these disruptions, creating more favorable conditions for deep sleep and complete sleep cycles. When you consistently experience quality sleep, you're more likely to develop steady progress in meditation practice rather than the frustrating pattern of good days followed by difficult days that many practitioners experience due to inconsistent sleep quality. The Buddha himself emphasized the importance of balancing sleep and wakefulness for effective practice. He advised against both excessive sleep, which leads to dullness and wasted time, and inadequate sleep, which leads to exhaustion and inability to practice effectively. Finding this middle way in sleep habits, including mindful attention to sleep position, creates a foundation for sustainable practice. Traditional Buddhist texts sometimes describe different types of obstacles that practitioners encounter in meditation. Many of these obstacles have direct connections to sleep quality. For example, sloth and torpor, a common meditation obstacle, often stems from inadequate or poor quality sleep, while restlessness and worry can be exacerbated by the physiological stress responses triggered by breathing disruptions or discomfort during sleep. By adopting left-side sleeping as a regular practice, you're addressing potential physical causes of these meditation obstacles before they arise. This preventive approach reflects the Buddha's emphasis on creating favorable conditions for practice rather than struggling against difficulties once they've manifested. Just as gardeners prepare the soil before planting seeds, practitioners prepare their physiological state through proper rest before attempting to cultivate meditation. Sleep position also affects the transition between sleep and wakefulness, a particularly important moment for practitioners who aim to maintain continuity of awareness throughout all states. Many meditation traditions place special emphasis on the moments just before falling asleep and just after waking up, when the mind is in a uniquely receptive state. By sleeping on your left side, you're more likely to transition smoothly between these states, potentially enhancing your ability to maintain mindfulness across the sleep-wake boundary. Some Buddhist traditions, particularly in Tibetan Buddhism, include specific practices for working with dream states and sleep consciousness. These advanced practices, sometimes called dream yoga or lucid dreaming practices, aim to transform sleep into an opportunity for spiritual development rather than a period of unconsciousness. Practitioners report that sleep position affects their ability to maintain awareness during dreams, with left side sleeping often supporting clearer dreams and greater dream recall, important foundations for these practices. The relationship between sleep quality and meditation extends beyond formal sitting practice to include everyday mindfulness. When you're well rested after quality sleep, maintaining present moment awareness throughout daily activities becomes noticeably easier. Conversely, poor sleep often results in a fragmented attention span and greater reactivity to stress, states that make moment-to-moment mindfulness more challenging. By supporting better sleep through mindful positioning, you're indirectly supporting continuous mindfulness practice throughout your day. Some meditation centers and monasteries actually include instructions about sleep position as part of their practice guidance, recognizing that these seemingly minor details can significantly influence practice quality. These instructions typically emphasize side sleeping, often specifically left side sleeping, with appropriate support for the head, neck, and knees to maintain spinal alignment throughout the night. For busy people integrating meditation into everyday life, sleep quality becomes particularly crucial. When practice time is limited, the quality of that practice takes on greater importance. By optimizing sleep through proper positioning, practitioners with busy schedules can experience more significant benefits from even short meditation sessions, making their limited practice time more effective and rewarding. The enhanced meditation quality that comes from proper sleep positioning creates a virtuous cycle in practice. Better sleep leads to better meditation, which often leads to better sleep the following night as the mental calm from effective practice carries into sleep hours. This positive feedback loop can help practitioners progress through challenging periods in their practice, using improved sleep quality as leverage to overcome obstacles. By bringing mindful attention to sleep position, you're extending meditation principles into a third of your life typically spent unconsciously. This represents a practical way to integrate Buddhist practice more fully into daily life, recognizing that even unconscious hours offer opportunities to create conditions that support awakening. The simple act of positioning your body mindfully before sleep becomes a form of practice in itself, extending the benefits of your spiritual path throughout your entire day and night. Beyond enhancing meditation quality, sleeping on your left side also helps balance the subtle energies known in traditional Asian medical systems as doshas. These energies, described in Ayurveda, a traditional Indian medical system that influenced Buddhist medicine, represent different physiological and psychological tendencies that exist in varying proportions in each individual. The three primary doshas, Vata, airspace, Pitta, fire/water, and Kapha, earth/water, need to remain in balance for optimal health and well-being. Left-side sleeping has traditionally been recommended in these systems for helping balance these energies, particularly for calming excess Pitta, the fiery, transformative energy. When Pitta becomes excessive, it can manifest as inflammation, irritability, acid reflux, skin rashes, or intense hunger. The left side sleeping position naturally helps cool and calm this energy, partly through its effects on circulation and digestion. For those with Pitta-dominant constitutions or those experiencing Pitta imbalances, left side sleeping can be especially beneficial. This position helps prevent overheating during sleep by optimizing circulation and reducing pressure on the liver, which is associated with pitta energy in traditional systems. Many people with these constitutions report feeling notably cooler and more comfortable when sleeping on their left side compared to other positions. The cooling effect extends to emotional states as well. Excess pitta energy can manifest as irritability, criticism, or anger, what might be called hot emotions. By helping to physically cool the system through improved circulation and reduced organ pressure, left-side sleeping potentially helps moderate these emotional tendencies, creating more balanced psychological states upon waking. While pitta benefits most obviously from this position, the other doshas also find support through the balanced physiology that left-side sleeping promotes. Vata, the airy dot. Mobile energy benefits from the grounding stability this position provides, while kapha, the earthy dot, stable energy benefits from the enhanced circulation that prevents stagnation. This multi-dosha balancing effect makes left-side sleeping valuable regardless of your constitutional type. Buddhist medical traditions, particularly those developed in Tibet, integrated these Ayurvedic concepts while adding their own unique understanding of subtle energies. Tibetan Buddhist medicine describes how imbalances in these energies affect not just physical health but also mental states and meditation experiences. By balancing these energies through practices like proper sleep positioning, practitioners create more favorable conditions for both physical health and spiritual development. Traditional Buddhist monasteries in India, Tibet, and Southeast Asia often incorporated knowledge of these energy systems into their daily routines. Monks and nuns would receive guidance on adjusting their diet, activities, and even sleep positions according to their individual constitutions and current imbalances. This personalized approach recognized that different bodies need different supports to achieve optimal balance. These traditional systems also recognized seasonal influences on energy balance. During hot seasons or in hot climates, the cooling effects of left-side sleeping become particularly valuable for preventing pitta excess. Similarly, during transitional seasons when vata tends to increase, the stabilizing effects of this position help prevent the anxiety and disrupted sleep that can accompany vata imbalances. The time of day also influences these energies, with different doshas predominating during different periods of the 24-hour cycle. The hours from about 10 at night to 2 in the morning are considered a pitta time, when the body conducts much of its transformative and digestive work. Sleeping on the left side during this period particularly helps prevent pitta from becoming excessive during these already pitta-dominant hours. Modern research offers interesting parallels to these traditional understandings. Studies on circadian biology show that body temperature, hormone production, and metabolic processes follow predictable daily rhythms that affect how we feel and function throughout the day and night. Sleep position can influence these rhythms by affecting core body temperature, digestive efficiency, and other physiological parameters that help synchronize our internal clocks. People with certain health conditions often benefit most noticeably from the dosha balancing effects of left-side sleeping. Those with inflammatory conditions, digestive disorders characterized by excessive acid or heat, or stress-related problems that manifest as irritability or overheating often report significant improvement when they adopt this sleep position consistently. This targeted benefit reflects the traditional understanding that left-side sleeping specifically helps cool and calm pitta energy. For Buddhist practitioners working with subtle energy practices like visualization or breathwork, balancing the doshas creates a foundation for more effective practice. When these fundamental energies are in balance, the more refined energies worked with in meditation practices can flow more freely and respond more readily to conscious direction. This creates a supportive relationship between basic physical practices like sleep positioning and more advanced energy practices. The accessibility of sleep positioning as a balancing practice makes it particularly valuable in modern contexts. While many traditional dosha balancing practices require substantial time, special ingredients, or expert guidance, Sleep position is something anyone can adjust immediately without special resources. This accessibility reflects the practical orientation of Buddhist medicine, which has always emphasized working with available means rather than requiring elaborate or expensive interventions. By consistently sleeping on your left side, you're participating in an ancient tradition of working with these subtle energies to support overall well-being. Whether approached through the traditional language of doshas or understood through modern concepts of physiology and circadian rhythm, this practice represents a simple yet effective way to create more balanced physical and mental states. The resulting harmony provides a foundation for everything from better digestion to clearer thinking to more effective meditation, truly a holistic approach to well-being that honors the interconnection of body, energy, and mind that Buddhist traditions have recognized for millennia. The balancing of subtle energies leads us naturally to consider another significant benefit of left-side sleeping: its remarkable ability to reduce back pain. Back pain affects millions of people worldwide and is one of the most common reasons people seek medical attention. It ranges from mild discomfort to debilitating pain that severely limits daily activities. While many factors contribute to back pain, your sleep position plays a crucial role both in preventing pain and in managing existing conditions. When you sleep on your left side with proper support, you help maintain your spine's natural curvature. This alignment is particularly beneficial when you place a pillow between your knees, which prevents your upper leg from pulling your spine out of alignment. This simple adjustment keeps your hips, pelvis, and spine in proper relation to each other, reducing strain on the muscles and ligaments that support your back. For people with specific back conditions, this proper alignment during sleep can make a tremendous difference in pain levels. Conditions like herniated discs, sciatica, spinal stenosis, and facet joint syndrome often respond positively to left-side sleeping because this position helps maintain space between vertebrae, reducing pressure on irritated nerves and inflamed tissues. Many people report waking with significantly less pain after adopting this sleep position compared to sleeping on their back or stomach. The benefits extend beyond just maintaining proper alignment. Left-side sleeping also helps reduce inflammation throughout the body by supporting optimal circulation and lymphatic drainage, as we discussed earlier. Since inflammation plays a major role in many types of back pain, anything that helps reduce overall inflammation potentially contributes to pain relief. By improving circulation to injured tissues and enhancing the removal of inflammatory compounds, this sleep position supports the body's natural healing processes. Muscle relaxation also improves in the left side position for many people. When your spine is properly aligned and supported, the muscles along your back can fully relax rather than remaining partially contracted to maintain stability. This complete relaxation allows these muscles to truly rest and recover overnight, potentially reducing the muscle tension that contributes to many types of back pain. The Buddha's teachings on physical suffering offer valuable perspectives on working with back pain and other physical discomforts. While the Buddha recognized that physical pain is an inevitable part of having a body, he taught that we have considerable influence over how we respond to pain and what conditions we create that either increase or decrease it. This realistic yet empowered approach neither denies physical suffering nor assumes we are helpless victims of it. In traditional Buddhist practice, the body is neither ignored nor indulged but rather worked with skillfully as part of the path. The Buddha himself demonstrated this balanced approach, caring for his body appropriately while not becoming overly identified with it. After years of practicing extreme asceticism that included harsh treatment of his body, the Buddha discovered that such practices didn't lead to awakening but instead created unnecessary suffering and obstacles to clear understanding. This discovery led him to advocate for what became known as the middle way, an approach that avoids both self-mortification and self-indulgence. Applied to back pain and sleep position, this middle way suggests finding positions that support health and comfort without becoming obsessed with perfect comfort or giving up entirely when some discomfort persists. It means working intelligently with the conditions of your body rather than fighting against them or ignoring them. Buddhist meditation traditions include specific practices for working with physical pain when it arises. These approaches don't replace appropriate medical care, but complement it by addressing the mental and emotional aspects of pain that often intensify suffering. Practitioners learn to observe pain with mindful awareness, rather than immediately reacting with aversion, tension, or storytelling about the pain. This mindful approach often reveals that what we experience as pain actually has many components: physical sensations, emotional reactions, mental narratives that can be worked with separately. For chronic back pain sufferers, combining appropriate sleep positioning with these mindfulness approaches can be particularly effective. The physical support of proper positioning helps reduce actual pain levels, while mindfulness practices help change the relationship to whatever pain remains. This combined approach addresses both the physical and psychological dimensions of pain, potentially reducing suffering even when some pain persists. In traditional Buddhist monasteries, particularly those where practitioners spend many hours in meditation, practical knowledge about body care is considered essential rather than separate from spiritual practice. Instructions about proper sitting postures are given alongside meditation teachings, and similar guidance about sleep positions forms part of the practical wisdom passed down through generations of practitioners. This integration reflects the understanding that physical and spiritual well-being are not separate domains, but aspects of an integrated approach to human flourishing. For busy people managing back pain in modern contexts, the simplicity of left-side sleeping offers particular value. Unlike many back pain interventions that require special equipment, ongoing treatments, or significant time commitments, adjusting sleep position is immediately accessible and can be implemented without cost or complexity. This accessibility makes it an ideal first-line approach for many back pain sufferers, potentially reducing the need for more invasive or expensive interventions. The relationship between back pain and mental states flows in both directions. Back pain can increase stress, irritability, and mental dullness, while these mental states often increase muscle tension and pain perception, creating a difficult cycle. By addressing back pain through proper sleep positioning, you potentially interrupt this cycle, creating more favorable conditions for both physical comfort and mental clarity. This connection between physical ease and mental well-being reflects the integrated understanding of human experience found in Buddhist approaches to health. Left-side sleeping represents just one component of a comprehensive approach to back health, but its simplicity and accessibility make it particularly valuable. When combined with other supportive practices, appropriate exercise, mindful movement, stress management, and medical care when needed, this sleep position creates a foundation for back health that supports not just pain reduction but overall well-being and functionality. This holistic approach reflects the Buddhist understanding that true health comes from addressing root causes and conditions rather than merely suppressing symptoms. Beyond helping reduce back pain, sleeping on your left side can significantly influence your dream experiences. Dreams have held special significance in Buddhist traditions for centuries, particularly in Tibetan Buddhism, where practitioners developed sophisticated techniques for maintaining awareness during dreams and using the dream state as a vehicle for spiritual development. These practices, sometimes called dream yoga, recognize sleep and dreams not as unconscious states without value, but as opportunities for developing insight and freedom. The position in which you sleep can notably affect both dream content and your ability to remember dreams upon waking. Many experienced dream yoga practitioners report that sleeping on the left side promotes clearer, more vivid dreams and enhances dream recall. This effect likely stems from several physiological factors that this position influences. First, left side sleeping generally supports more stable breathing patterns throughout the night, as we discussed earlier. This respiratory stability helps maintain consistent oxygen levels in the brain, supporting the neural activity associated with dreaming. When breathing is disrupted during sleep, as often happens with back sleeping, which can increase snoring and sleep apnea, dream cycles may be fragmented or interrupted, making dreams less coherent and harder to remember. Second, this position enhances circulation to the brain by working with gravity to optimize blood flow through major vessels. Better circulation means better delivery of oxygen and nutrients to brain tissues, supporting the intensive neural activity that occurs during dreaming. This improved brain perfusion may contribute to more vivid dream experiences and stronger memory formation during dreams. Third, left-side sleeping potentially reduces pressure on the heart, allowing it to function more efficiently throughout the night. This cardiovascular ease means the brain receives more consistent blood supply during all sleep stages, including REM sleep when most vivid dreaming occurs. The result is potentially longer, more stable REM periods that allow dreams to develop more fully. In Tibetan dream yoga tradition, practitioners receive specific instructions on sleep positions that support lucid dreaming, the state of becoming conscious within a dream while still remaining in the dream state. While these instructions sometimes vary depending on the specific practice and individual needs, the left side position, often called the lion posture after the way the Buddha is said to have slept, is frequently recommended as supportive for developing dream awareness. The practice of dream yoga involves more than just sleep position. Of course, practitioners typically engage in specific visualizations before sleep, set clear intentions to recognize the dream state, practice reality testing during waking hours, and work with various meditation techniques that develop the stability of awareness needed to maintain consciousness during dreams. However, sleep position is considered an important foundation that creates favorable physical conditions for these more subtle practices. From the perspective of dream yoga, dreams offer a unique opportunity to recognize the constructed nature of experience. During dreams, we create entire worlds that seem completely real while we're experiencing them, only to dissolve upon waking. This natural process offers a vivid demonstration of how our mind creates and projects reality in all states, not just during dreams. By becoming conscious within this process through lucid dreaming, practitioners gain experiential insight into the nature of perception and reality. Traditional texts describe dream practice as particularly valuable because it helps extend awareness into states usually dominated by unconsciousness. Most people lose mindful awareness when they fall asleep, regaining it only upon waking. Dream yoga practitioners work to maintain continuity of awareness across all states, waking, dreaming, and deep sleep, recognizing that true awakening isn't limited to just the waking state, but encompasses all modes of consciousness. The ability to remember dreams is crucial for this practice, making dream recall an important foundation skill. Left-side sleeping appears to support better dream recall for many practitioners, creating more opportunities to work with dream content. This improved recall likely relates to both the physiological factors mentioned above and to how this position supports smoother transitions between sleep stages, making it easier to bring dream memories into waking consciousness. Different types of dreams are recognized in traditional Buddhist dream practice, including ordinary dreams that process daily experiences, dreams influenced by physical conditions like illness or digestion, prophetic dreams that provide insights about future possibilities, and clear light dreams that reveal deeper aspects of mind. Sleep position potentially influences which types of dreams predominate, with left-side sleeping often associated with clearer, more insightful dream experiences. Modern sleep research offers some scientific support for these traditional observations. Studies have found that sleep position can influence dream content, with side sleeping associated with different types of dreams compared to back or stomach sleeping. The physiological effects of different sleep positions on breathing, circulation, and nervous system states create varying conditions that influence dream experiences in ways that align with traditional understandings. Some research also suggests that left-side sleeping may support better memory consolidation during sleep, since dreams appear to play a role in this consolidation process. integrating daily experiences and emotions into existing memory networks. The enhanced memory processing associated with this position may contribute to both dream quality and the learning that happens through dreams. For those interested in exploring dream practice from a Buddhist perspective, sleep position offers an accessible starting point that requires no special training or belief system. Simply adjusting how you position your body before sleep potentially creates more favorable conditions for remembering and working with dreams, whether your interest is spiritual development, psychological insight, or simply enjoying the fascinating experiences dreams provide. The relationship between dreams and waking awareness flows in both directions. Clearer dreams often lead to more mindful waking states, while more mindful days typically lead to clearer dreams. By supporting better dream experiences through proper sleep positioning, you potentially create a positive feedback loop that enhances awareness in all states. This interconnection reflects the Buddhist understanding that all aspects of our experience influence each other, creating either obstacles or opportunities for awakening depending on how skillfully we work with them. Whether approached as a spiritual practice or simply as a way to enhance an intriguing aspect of human experience, working with dreams offers unique benefits that complement other aspects of well-being. The simple practice of left-side sleeping represents one accessible way to support this dimension of consciousness, creating conditions that allow the natural wisdom and creativity of your dreaming mind to flourish more fully. The rich world of dreams connects intimately with our stress levels and emotional well-being, which brings us to another significant benefit of left-side sleeping: its remarkable ability to reduce stress and promote deeper relaxation. In our fast-paced modern world, stress has become almost ubiquitous, affecting physical health, mental clarity, and emotional balance. The position in which we sleep can significantly influence how effectively our bodies process and release stress during rest hours. When you sleep on your left side, you naturally activate your parasympathetic nervous system, often called the rest and digest system, more effectively than in other sleep positions. This branch of your autonomic nervous system governs relaxation, regeneration, and recovery processes. It counterbalances the sympathetic fight or flight system that activates during stress and danger. By enhancing parasympathetic activation during sleep, left-side positioning helps your body more completely shift into restoration mode. This parasympathetic activation occurs partly because left-side sleeping improves circulation patterns while reducing pressure on your heart and other vital organs. When these organs function with less restriction, they send fewer stress signals to your brain. Your nervous system interprets this ease as safety, allowing deeper relaxation to occur. The resulting biochemical cascade includes reduced production of stress hormones like cortisol and adrenaline, and increased production of relaxation hormones like serotonin and melatonin. The physical comfort of proper alignment in this position also contributes to stress reduction. When your spine maintains its natural curves and your muscles can fully relax, you experience fewer discomfort signals that might otherwise trigger subtle stress responses throughout the night. This physical ease translates to mental and emotional calm. As the body-mind connection works in both directions, physical ease promotes mental calm, and mental calm enhances physical relaxation. In Buddhist traditions, particularly those focused on cultivating tranquility, practitioners recognize the importance of creating favorable conditions for peace to emerge naturally. Rather than forcing the mind into artificial calm, Buddhist approaches typically involve removing obstacles to the natural peace that emerges when agitation subsides. Sleep position represents one such condition that either supports or hinders this natural emergence of tranquility. The Buddha himself emphasized the importance of appropriate resting postures as part of mindful living. In the Satipatthana Sutta, a key text on mindfulness practice, the Buddha instructs practitioners to maintain awareness of the body in all four postures: walking, standing, sitting, and lying down. This teaching recognizes that how we position our body influences our mental and emotional states. even during periods of rest and sleep. Traditional Buddhist monasteries typically maintain clear guidelines about sleep, including when to sleep, how long to sleep, and in what position to sleep. These guidelines aren't arbitrary restrictions, but reflect centuries of observation about what conditions best support both physical health and spiritual practice. The left side sleeping position, sometimes called the lion's posture in reference to how the Buddha reportedly slept, is often specifically recommended. For practitioners of meditation, the stress-reducing benefits of left-side sleeping create a foundation for more effective practice. Chronic stress creates obstacles to meditation by promoting mental agitation, physical tension, and emotional reactivity. By reducing baseline stress levels through proper sleep positioning, practitioners potentially encounter fewer of these obstacles when they sit for formal practice. The stress reduction extends beyond just the sleep period itself. When you consistently experience deeper, more restorative sleep, you typically begin the day with lower stress hormone levels and a more balanced nervous system state. This creates a more favorable starting point for maintaining calm throughout your waking hours, potentially reducing your reactivity to stressful situations and enhancing your resilience when challenges arise. Many Buddhist meditation traditions include specific practices for cultivating peace, such as loving-kindness meditation, metta, and tranquility meditation, samatha. These practices work more effectively when beginning from a foundation of relative calm rather than from a state of high agitation. By supporting stress reduction through proper sleep positioning, practitioners create more favorable conditions for these peace-cultivating practices to take root and flourish. The physical mechanisms behind this stress reduction are increasingly understood by modern science. Research shows that quality sleep in proper positions helps regulate the hypothalamic pituitary adrenal HPA axis, which governs stress hormone production. When this system functions optimally, cortisol follows its natural daily rhythm, highest in the morning to energize you for the day and lowest at night to allow proper rest. Disrupted sleep or poor positioning can dysregulate this system, leading to inappropriate cortisol patterns that increase overall stress. Left-side sleeping also supports optimal function of the vagus nerve, a crucial component of the parasympathetic nervous system that connects your brain to many major organs. When the vagus nerve functions well, it helps regulate heart rate, digestion, and inflammatory responses, all of which influence stress levels. By reducing pressure on the organs that the vagus nerve innervates, this sleep position potentially supports better vagal tone and function. Traditional Buddhist understanding recognizes connections between physical positions, breath patterns, and mental states. By adopting positions that naturally calm the breath and reduce physical tension, practitioners create conditions that support calmer mental states. This understanding doesn't separate physical, energetic, and mental well-being but sees them as interdependent aspects of a unified system. For busy people in modern contexts, simple stress reduction techniques like mindful sleep positioning offer particular value. Unlike stress management approaches that require significant time commitments or specialized training, sleep position adjustment is immediately accessible to almost everyone. This accessibility makes it an ideal starting point for people interested in reducing stress and cultivating greater peace in their lives. The effects of chronic stress extend far beyond momentary discomfort, potentially contributing to numerous health problems from heart disease to immune dysfunction to mood disorders. By addressing stress at the foundational level of sleep position, you potentially create protective effects that ripple throughout your health and well-being. This preventive approach aligns with the Buddha's emphasis on addressing the causes and conditions of suffering rather than merely treating its manifestations. By making left-side sleeping a regular practice, you're leveraging a simple but powerful tool for stress reduction that works with your body's natural processes rather than against them. This approach exemplifies the practical wisdom of Buddhist health traditions, working intelligently with the conditions of your body and mind to create greater harmony and ease. The resulting reduction in stress creates space for peace to emerge naturally, not as something forced or artificially created, but as the natural state that reveals itself when agitation subsides. The stress-reducing effects of left-side sleeping directly influence how you feel upon waking, which connects to our final benefit, optimizing the morning awakening experience. The way you transition from sleep to wakefulness sets the tone for your entire day, influencing everything from your energy levels to your mood to your mental clarity. Left-side sleeping creates conditions that support a smoother, more refreshing awakening experience. When you sleep on your left side with proper support, you typically experience more complete sleep cycles and fewer disruptions throughout the night. This continuity of sleep means you're more likely to wake naturally at the end of a sleep cycle rather than being jolted awake from deep sleep by an alarm. This natural awakening produces a very different experience from the groggy, disoriented feeling that comes from interrupted deep sleep. Left-side sleeping also supports better brain waste clearance through the glymphatic system, as we discussed earlier. This nighttime cleaning process helps clear metabolic waste products that accumulate in brain tissues during waking hours. When this system functions efficiently, you wake with clearer cognition and greater mental sharpness, free from the brain fog that often accompanies poor sleep. The improved circulation and breathing patterns supported by this position mean your brain and tissues receive optimal oxygen throughout the night. This consistent oxygenation contributes to waking with greater vitality and clarity rather than the sluggishness that can result from subtle oxygen deprivation during sleep. You're essentially starting your day from a foundation of better nourished tissues and more balanced biochemistry. In Buddhist practice traditions, particularly in monastic settings, the dawn hours hold special significance. Many monasteries maintain schedules where practitioners rise before sunrise for their first meditation session of the day. This timing isn't arbitrary, but reflects observations that the early morning hours offer unique advantages for meditation and spiritual practice. The quality of this important morning practice period depends significantly on the quality of the transition from sleep to wakefulness. When practitioners wake refreshed and clear-minded after quality sleep, they can immediately engage with practice rather than struggling against grogginess or dullness. The left side sleeping position, by supporting optimal sleep quality and natural awakening, helps create favorable conditions for this crucial transition. Buddhist traditions often emphasize the importance of how we begin our day, recognizing that initial states tend to influence what follows. Many practice traditions include specific routines for the first moments after waking, such as setting intentions, offering gratitude, or engaging in brief meditation before even rising from bed. The clarity and presence that comes from quality sleep creates a foundation for these important morning practices. The relationship between morning clarity and spiritual practice appears across many Buddhist traditions. In Zen monasteries, practitioners typically rise early for zazen sitting meditation during what's considered an auspicious time for practice. In Tibetan traditions, the early morning is often dedicated to deity visualization practices that require clear mental focus. In Theravada traditions, monks and nuns typically begin their day with meditation and chanting practices during the pre-dawn hours. This emphasis on morning practice connects to observations about the natural rhythms of consciousness throughout the day. Many practitioners report that the mind has a special quality in the early morning, more settled, less fragmented by the day's activities and concerns. This natural clarity is enhanced when supported by quality sleep in positions that promote optimal physiological function. Modern research on circadian rhythms offers interesting parallels to these traditional observations. Studies show that different cognitive abilities peak at different times throughout the day, with many executive functions showing advantages in the morning hours for most people. By optimizing your sleep position to support morning clarity, you're potentially enhancing your access to these natural cognitive peaks. The brain undergoes several important processes during the transition from sleep to wakefulness. Neurotransmitter systems shift, brainwave patterns change, and body temperature begins to rise. Left-side sleeping supports smoother function of these transitional processes by reducing disruptions to sleep architecture and supporting optimal brain circulation and waste clearance throughout the night. For many Buddhist practitioners, establishing continuity of mindfulness between sleep and waking states represents an important aspect of practice, rather than having awareness completely disappear during sleep and suddenly return upon waking. More experienced practitioners work to maintain a thread of awareness throughout all states. The quality of the transition between these states, influenced by sleep position and other factors, affects how successfully this continuity can be maintained. In traditional Buddhist practice settings, the morning routine often begins with conscious attention to the first moments of waking. Practitioners are encouraged to notice their first thoughts, the quality of their mind, and the state of their body as they transition from sleep to wakefulness. This mindful observation creates an opportunity to set intentions for the day and establish patterns of awareness that can continue throughout waking hours. The Buddha himself reportedly emphasized the importance of how practitioners begin their day. In some texts, he advises monks to rise with thoughts of loving kindness and to maintain mindful awareness from the first moment of waking. This instruction recognizes that initial states tend to establish patterns that continue throughout the day, making the quality of morning awakening particularly significant for ongoing practice. By supporting optimal sleep quality and natural awakening through left-side sleeping, you create conditions for beginning your day from a place of greater clarity, energy, and presence. This doesn't guarantee a perfect day, of course, but it establishes a more favorable starting point from which to meet whatever the day brings. The resulting clarity potentially supports not just formal spiritual practice, but all daily activities, from work to relationships to creative pursuits. For busy people integrating Buddhist principles into everyday life, optimizing the sleep-wake transition offers particular value. When morning practice time is limited, the quality of that practice takes on greater importance. By supporting clear awakening through proper sleep positioning, practitioners potentially experience greater benefits from even brief morning practice sessions, making the most of limited time. The practice of mindful sleep positioning represents a beautiful example of how Buddhist wisdom applies to the most ordinary aspects of daily life. By bringing awareness and intention to something as simple as how we position our body for sleep, we transform what might seem mundane into an opportunity for practice. This integration of mindfulness into everyday activities reflects the essence of Buddhist practice, not as something separate from daily life, but as a way of bringing awareness and wisdom to every moment and movement, creating conditions that support awakening in all its forms.